Hello, everybody, and welcome to our on-demand webinar that's part of the Wellness Summit 2021. That's going to be taking place August 12th and 13th, downtown Indianapolis at the Westin. And this video is being provided to you on demand so that you can watch it at any time. My name is Tina Darling. I am the Program Director for Connecting Kids to Coverage at the Indiana Rural Health Association. And I'm here with my colleague, Ann McCafferty. And we are going to talk to you today about healthcare options for employers, specifically how small businesses can help their teams. Sorry about that. We are funded by the Centers for Medicare and Medicaid Services, so I am required to show this disclaimer slide to you, which you can come back and see later at your convenience. Here are our learning objectives today. Specifically, we would like all of you watching to be able to differentiate between and among Indiana's health coverage programs, as well as the Children's Health Insurance Program. For example, who qualifies for which one based on age, income levels, and also how marketplace tax credits may help employees afford health coverage. Secondly, we would like for you to be able to list the ways that employers can be ready to assist their employees who may be interested in applying for an Indiana health coverage program or a marketplace plan. And last, to understand the role of licensed Indiana insurance navigators and where they can be found. And both Ann and I, as well as two others on our team, are licensed Indiana insurance navigators. And so here's our picture. This is what we all looked like when the pandemic started, and we were wearing masks made by our colleague Anita Brown. As I said a moment ago, we are 4 licensed Indiana insurance navigators, and we also have a data coordinator. And 4 of us are also marketplace certified application counselors. Because we are funded by the Centers for Medicare and Medicaid Services, we are able to provide free health insurance application assistance for the Healthy Indiana Plan, for Hoosier Healthwise, and for Marketplace. We are 100% virtual as a result of the pandemic. And we have 100% HIPAA secure options so that all of your information remains totally safe. We are available statewide, and we're also able to do educational sessions for organizations similar to what we're providing here. And here's just a little bit about our Cooperative Agreement Award, which I will probably call a grant several times throughout these slides. But we are part of a national campaign with 39 grantees across the country, but this is the first time that the Indiana Rural Health Association has received funding from CMS. We are excited to report that we just finished our second of 3 years of original funding, and we still have a year left, which will end at the end of June 2022. And our program has 4 primary goals: to raise awareness about health coverage options in the state of Indiana, to create opportunities for people to get an application completed, to motivate parents to not only get their children enrolled, but to keep them enrolled from year to year, and then also to provide outreach guides and toolkits to interested parties and organizations if those can help keep your constituents educated. And I wanted to point something out. We've got our website URL posted on several slides. And please visit our website because we have a lot of really great resources available to you. For example, these slides will be posted there as well as made available through the Wellness Council, but we have other webinars recorded that might be of interest to you. Everything from pregnancy and Medicaid to newly arriving immigrants to the United States and to the state of Indiana, along with some FAQ documents that go with those webinars. So we invite you to check out our website and see what else you can learn about health coverage. The Indiana Rural Health Association, where we are housed, was founded in 1977. We are a member-driven nonprofit with individuals, healthcare organizations, and other statewide programs and organizations as our members. And our mission is quite simply to improve the health of Hoosiers living in rural areas. And many of you watching might live in an urban area, but everything we're talking about here pertains to you, and the Indiana Rural Health Association considers urban areas just as much of a catchment area for our mission as much as rural areas. And again, there's the website for the Indiana Rural Health Association. So why was Indiana funded with this award from the Centers for Medicare and Medicaid Services? Well, quite frankly, our child uninsured rate in Indiana is not good. It's 7.1%. And I will tell you, when we were originally funded 2 years ago, this number was 6.1%. So it has gotten a little bit worse. And this number is from 2019. And so it's not as a result of the pandemic that this number went up. And we're not sure why it did, but it places us 40th in the 50 states as far as child insurance rates. So we are working really hard to change that. Conversely, here are numbers that reflect uninsured rates for the non-elderly by age. And when I say non-elderly, that's anybody that's not eligible for Medicare, because that's a whole separate category. But you can see on this table here, again, children in Indiana are uninsured at the rate of 7%. Adults, it's at 11%. So we're looking at about an average of 10% of Hoosiers are not insured. And we want to try to help people understand that they've got options so that we can bring those percentages down. And with that, I will turn it over to my colleague, Ann McCafferty, and she's going to go into some more details about health coverage options in Indiana.
Thank you, Tina, and thank you for your help in advance for navigating my slides.
Thank you.
And thank you, everybody, for having us here today and allowing us the opportunity to share our program. So to start, our theme is how small businesses can help their team. So I want to give just kind of a high-level look as an example of ways we share with perhaps your employees to help that team understand their options for health insurance in Indiana. So to start, and you're on my screen, and I have left it blank intentionally, so we're doing well. So I want you to clear your mind, because I'm going to ask you to participate with me in a little word association exercise. And again, I've intentionally left this slide blank because I want you to be free from distractions. Clear your mind. Ready? When I say Progressive insurance, what is the first thing that pops into your mind? Auto insurance? Home insurance? There's no right or wrong answer. Now clear your mind again. When I say flow from Progressive, now what pops into your mind? Maybe this? I think it's a safe assumption that most of you probably recognize flow from Progressive. I would say that is some very powerful branding, wouldn't you? But why flow? Why does flow work so well as the face we associate Progressive insurance with? And why am I talking about flow? Virginia Commonwealth University Brand Center professor Kaylee Caldwell says this about flow. We are paying for something we hope we never need, and if we do need it, we want to believe that it will be easy and human. Flo seems like the kind of person we would hope to get on the other end of the line to help us through an unpleasant situation. Seems simple enough. She goes on to say, Flo humanizes insurance, something that can feel pretty impersonal. This is exactly our hope today as we look at a few health insurance options in Indiana and provide you with a simple overview of different programs and try to humanize something that can feel pretty impersonal. Next slide, please. So let's start with the very basics. Health insurance will not cover all your costs. It does typically cover most doctor and hospital visits, prescription drugs, wellness care, and medical devices. Most health insurance, however, will not cover elective or cosmetic procedures, off-label drugs, and or certain services or medications that are not deemed medically necessary or that the insurance company feels may skip certain steps to achieve a desired outcome related to your health care. Health insurance is designed to share costs with you. Cost sharing is exactly that. Most of us can relate to the concept of cost sharing because of our understanding of how auto insurance works. You pay a monthly amount of money, and in return, should you sustain damage to your vehicle, you have purchased a product that will arrange for compensation that will prevent you from paying the full amount to repair the damage or replace the irreparable. This is the true definition of being insured. You paid your part, and when you need it, the insurance company will pay their part. It's cost sharing 101. And the third basic, there is an out-of-pocket limit to the amount of cost that you're required to share. And we're going to talk about out-of-pocket limits in a little bit more detail as we move on. But if you go to the next slide for me, please. Since we've covered the basics, let's look at where we as Indiana residents might be able to find health insurance for ourselves and our families. And how do we know that we are making a wise purchase? So I've listed some common insurances, and you may be familiar with most of these, or at least recognize their names. And as you can see, I have pointed out a few of these with a yellow arrow. These are the plans I would like to focus on today. And I want to provide a bit more detail as far as cost sharing requirements, eligibility requirements, and direction in how to enroll into these particular plans and where to go for assistance. You also may notice a big green check mark. The reason the plans on this list receive this big green check mark is because these plans have been identified as qualified health plans, or I will refer to them as QHPs going forth. So what does that mean? What is a QHP? A QHP is a plan that provides essential health benefits and follows the established limits on cost sharing and out-of-pocket maximum amounts. These plans meet the requirements of the Affordable Care Act by providing a core set of benefits that have a set standard of coverage requirements. QHPs must offer a minimum actuarial coverage or their required shared cost amount of 60%. So there's cost sharing with you at that 60%, their responsibility, 40% your responsibility. And again, just to reiterate, 60% is the minimum percentage. Your plan may cover more than 60%, but to be considered a QHP plan to get that big green check mark, the insurer has to at least agree to pay 60% of an individual's expected cost or the actuarial value of a healthcare cost within a core set of benefits. And we'll talk about that core set in the next couple slides. Next slide, please. So we now have a quick overview of what defines a QHP. Let's look at some common names that we might recognize that don't qualify as a QHP and are indicated so with a big red X. Now, this big red X does not mean they're bad, and it was only an attempt to separate a QHP from a plan that might be presented to you, and as a means of understanding what is a QHP and what isn't a QHP. So I'm not saying that these are bad plans. I just want you to recognize the difference. So let's look at the first one. A plan that's not a QHP would be a standalone plan. A standalone plan only offers cost sharing within a certain specialty of care. The most common standalone plans that we might recognize are dental and vision plans. Employers oftentimes offer these standalone plans, and you may be presented with an option to purchase one of these through your employer's benefits package. If you are employed by a company with 50 or less employees, these employers are not legally required to offer you a QHP health insurance plan. So make sure you understand what is being offered in terms of insurance as a benefit to you as an employee. The second plan would be considered a limited plan. Workers' compensation is a great example of a limited plan. This plan pays a percentage of your cost, but this requirement is limited to work-related incidents or accidents, and therefore may not cover all the essential health benefits of a QHP. The third would be considered a supplemental plan. Workers' compensation, this is a plan that offers a supplement to help you pay your share of the cost. Remember, QHPs have to pay at least 60%, so that leaves you with an additional 40% of the cost. So a good example of a company that offers a supplemental plan, and one we're probably all familiar with, is Aflac. When my children were young, as an example, they were very active and participated in travel sports, and we experienced our share of emergency room visits. Accident supplemental insurance might have been a consideration for us. 40% of a $500 ER visit is still $200. And that $200 might have been reduced with an accidental supplement plan. And then the last one is a discount plan. A good example of a company that offers a discount plan is Sidecar Health. Sidecar Health members pay a membership fee and in return may qualify for discount on certain services. It's very much like a GoodRx card that I think we're becoming more familiar with. GoodRx is not insurance, but by presenting that GoodRx card at the pharmacy, you may receive a percentage off of the normal cost of that prescription. Next slide, please. So again, I'm not marking these with a big red X because they're bad, or the green because they're the best. I just want you to recognize the difference between the two so that when you start shopping for a plan, you'll know how to identify a QHP from a non-QHP plan. And we know that now because of these couple things. The health plan is designed to pay at least 60% of the total cost of the medical services for a standard population. The health plan includes substantial coverage of physician and inpatient hospital services and has that minimal essential health benefit value at 60%. So that's your little checklist. So you can make your own green marks and red marks. Next slide, please. So I mentioned minimum essential coverage. There are 10 categories that a QHP must offer that 60% cost sharing value. And I've listed those on this slide. I'm not going to read each one. We'll quickly let you kind of skim them, but you can see they're everywhere from laboratory services, ambulatory patient services, mental health, maternity, and newborn care. So you have that wide variety within those 10 essential health coverage benefits. And again, limited plan like dental and vision, you're only getting dental and vision. So you know you're not going to get lab service, and you know you're not going to get that emergency service coverage you may need in the future. Next slide. So unfortunately, health insurance, because it is somewhat impersonal, and it's kind of boring at times, is not something we often discuss. And a lot of times we just don't know what questions to ask when we start looking. I'm not going to read through all of these, but I do want to show an example of ways we might help an employee know if they're enrolling into what is best for their individual situation. So this is a list of questions that they might take with them to their HR or to their benefits specialist while enrolling into a new position and being offered that health insurance for the first time. Next slide. So what if your employer does not offer health insurance? And remember, I said that employers with employees less than 50 aren't legally obligated to make that offer to their employees. So what if you fall into that category? There are other options. And the first one we're going to look at is the Healthy Indiana Plan. The Healthy Indiana Plan is our state's expanded Medicaid program, and it is expanded because it is offered to non-disabled adults based on their household size and income. And this would be adults aged 19 to 64, because as Tina mentioned, turning 65, you're now eligible for Medicare. So we're going to focus on that adult age of 19 to 64. Because this program is based on income eligibility, Indiana recognizes that cost sharing is difficult. And when adults qualify for and enroll into this program, instead of paying a monthly premium and reaching a deductible amount, it is asked that the member pay a contribution between $1 and $20 a month, and in return, co-pays and cost-sharing obligations are waived. With this contribution also, members will receive enhanced benefits of dental, vision, and chiropractic coverage as well. Members can choose from 4 managed care entities: Anthem, CareSource, MedWise, or MHS. And these are entities or companies that manage their claims, manage their benefits. And these MCEs also offer extra rewards, benefits such as gift cards for completing wellness screens, free or reduced cost memberships through programs such as Weight Watchers or participating fitness centers. Next slide. So once again, eligibility for the Healthy Indiana Plan is based on income and household size. And when applying, a standard of information must be provided, including names and dates of birth, Social Security, residency verification, and income verification for those in the household, as well as household tax relationships. Next slide, please. So this is the 2021 eligibility guideline chart for the Healthy Indiana Plan. You will notice that there are 2 programs, HIP Basic and HIP Plus. HIP Plus is the preferred program as well as the default program for eligibility. But to protect those whose household incomes fall less than 100% of the federal poverty level, which is that $1,074 amount for a household of 1, if the contribution is not made for 60 days for that HIP Plus member, instead of losing their benefits altogether, they are placed into this HIP Basic coverage. And with HIP Basic, you do lose those enhanced benefits of dental and vision. And there are some associated cost sharing through co-pays for prescription and doctor visits. As an option to those adults with an income over this set amount, so we'll look at the HIP Plus category. So let's say you're a household of 4, you make over $3,048, and this is gross income. So this means before your taxes are taken out, both earned and unearned income, you fall or you are over that guideline. What are your options then? Next slide, please. So in this situation, eligibility requirements change a little bit. And to be eligible for a marketplace plan, you must, go ahead and flip forward for me, Tina, to the next one.
Sure.
Thank you. Eligibility requirements are: you must live in the United States, be a US citizen, national, or lawfully residing. and you cannot be currently incarcerated at the time of your eligibility application. And what you're applying for Marketplace, as far as eligibility, is your eligibility to go ahead and purchase a plan off healthcare.gov, the shopping tool for those who are seeking a plan through the Marketplace, and your eligibility to receive cost savings through tax credits and even maybe some additional cost sharing to reduce your deductibles and your copay amounts. Next slide. So ordinarily, Marketplace has an open enrollment period. That period typically would fall between November 1st and December 15th every year. And it's only during that time that you would be able to apply for that eligibility to go on to select a Marketplace plan. However, because of the public health emergency and the CARES Act, special concessions been made, and a special enrollment period has been opened up, is currently open now. So everyone has the opportunity to go ahead and go on and apply to see what their eligibility would be. Now, as of now, that open enrollment, special enrollment period is set to end August 15th. So I would encourage you to go ahead and do that. And you can do that by visiting healthcare.gov. And there's an example of what the log-on homepage looks like, so you know you're at the right place. Next slide, please. So we've talked about adults, ages 19 to 64, and you may think, well, I'm not eligible for the Medicaid expanded plan or a Medicaid program, so my children aren't eligible either. Well, let's look at the children's options in Indiana. Through the Children's Health Insurance Program, or Hoosier Healthwise, plan options are available for children. And we're going to look at the income guidelines, but you're going to see that they're far more generous than for the adults seeking eligibility to obtain Medicaid or an expanded Medicaid Healthy Indiana Plan program. So let's look at the two packages within Hoosier Healthwise. Package A, and I'll do this real quickly, they're very similar, but Package A has an income standard cutoff that will enable you to enroll into a no-cost health insurance. And when I say no cost, there is no cost sharing obligation. So no monthly premium, no co-pays, and this coverage will have a 12-month eligibility period. Package C is a little bit different. The income guidelines are higher, and there is a bit of a cost share obligation, but it's very low cost. And that would be for the monthly premium and for copays. And next slide, please. So let's look at that income breakdown. So remember, two packages, Package A, Package C for children. A household of 4 can have a gross household income of $5,631 and still qualify for their children to enroll at Package C with a premium for 2 children, I believe now is perhaps $53 to $70 a month, and some co-pays that might be $3 to $4 for doctor visits and prescriptions. Next slide, please. So we quickly went through some eligibility guidelines and some program options. It's a lot. I know it's a lot of information. So where do you turn for help? So I'm going to turn it back to Tina, and she's going to give you some options for assistance and where to find that assistance.
Thank you so much, Anne, for that comprehensive view. And what I'm going to help people understand now is where do you turn to for help? Because as Ann said, a lot of what she went through, it was very dry, it's boring. And even though she did such a good job explaining it, you're going to forget some of what you have seen and heard. But that's where a licensed Indiana insurance navigator can help you. A licensed Indiana insurance navigator can help you understand what's a QHP and what's not. And it can help you understand that if, you know, maybe you didn't qualify for the Healthy Indiana plan, but let's check and make sure that your children might be eligible for the Hoosier Healthwise. These are things that we are trained to kind of tease out and help you understand. But I don't know how many of you have ever even heard of an insurance navigator. And if you have you wondered what the difference is between an agent and a broker, agent or a broker, and a health insurance navigator? Well, a navigator is licensed by the Department of Insurance in the state of Indiana. We can help you complete the application, follow your application status, and remind you of missing documents or upcoming due dates. And most importantly, we do this at no cost to you. We are absolutely free. So we're kind of like a second set of eyes and ears. The way the state of Indiana has things set up, if we become your authorized representative and you sign a piece of paper authorizing us to do that, whatever information you get from the state of Indiana in your US mail, we will get it as well. And so let's say you've moved and your mail has not caught up to you yet. We will get that same piece of mail and we'll actually call you on the phone and say, hey, the state of Indiana is waiting on some additional information from you. Don't overlook it. And if you need me to, you know, email this to you or whatever way so that you can get it more quickly, let us know. Because the state does have a finite number of days for you to return some information when they request it. So that's some of what a navigator can do. Essentially, we just help you. And here's a nice chart that gives you the difference between an insurance navigator and an agent broker. And I will draw your attention to that third line. An agent or a broker is not free. You pay for that service or they get paid for the help they provide you. But a navigator is free. We are unbiased. We're not employed by a specific insurance company trying to get you to utilize that product. We receive training. We cannot recommend a plan to you. All we can do is help you apply, especially for Indiana health coverage programs. We help you fill out the application, and then it's up to the state of Indiana to determine where you fall based on your eligibility. With Marketplace, it's the same thing. We can help you fill out the application, but we cannot recommend a plan to you. That is your decision to make as a consumer. But we can help you with the applications for all of these things: Medicaid, CHIP, and Marketplace. So where can you find a navigator? Well, we are in a lot of different places, and here are just some. The first one is an organization called Covering Kids and Families. And the CKF navigators usually are housed in a local community action agency in your town. Lots of times they're in a United Way or someplace like that. They have an 800 number that I've got listed here, as well as a website you can explore. You've got our contact information next, including our website. And then if you've ever heard of something called a Federally Qualified Health Center, or FQHC, these are health centers that are located in many communities. They're located by they're funded by the Health Resources and Services Administration, or HRSA. And part of their requirement to even exist is to provide assistance for insurance application and enrollment. And so they frequently employ licensed Indiana insurance navigators. And then there's a company out there called ClaimAid, and they're available in some hospitals. Some of you may have received assistance from a ClaimAid navigator if you've ever been in a hospital setting, which is perfectly fine. Here are pictures of our flyers, and I'm happy to tell you that these flyers will be made available to you as handouts along with these slides, but this is available in both English and Spanish. And when you get these, you are welcome to photocopy them, email them, fax them, share them with whomever you need to help spread the word about the help you can get from our program. I'll turn it back over to you, Ann.
Great. So what do you think, Tina? Should we play again?
I think so.
Okay, So clear your mind. We're going to play word association again. When you hear Indiana Rural Health Association connecting kids to coverage Indiana, what pops into your mind? Next slide. Just like Flo. Flo's thinking of us. There we are. Quick way to get a hold of us. If you scan that QR code, it'll pop you to a link on your smartphone, and that link will allow you to enter information in a PII, or personal identifiable information secure portal. You can reach out to us, and in return, this lets us know your preferences of when you would like us to contact you. And we will do that within 3 business days and start your free assistance. Next slide, please.
Yep.
You can also find us on social media at Twitter and Facebook. We would love it if you would like us and share us on Facebook, as well as retweet us on Twitter. Next slide, please. And then the old-fashioned way, if you want to email us, Tina has left her email as well as my email, and that's included in this slide. So thank you, Tina, for letting me sit in with you on this, and thank you, everybody, for allowing us this opportunity to share our program. And bye. Have a great day. Thank you, Tina.
Thank you, Anne. And I will say, if whether you are an employer or a health or an employee, if you need any help, or if anything that we have said here today is of interest to you and you'd like to speak with us further, please contact either Anne or myself at one of those emails. And since this is an on-demand pre-recorded webinar, unfortunately, we're not available to take questions right now, but again, follow up with us. We would love to hear from you. Thank you so much for joining us, and we hope you have a good day.